Good afternoon, everyone. My name is Malia Richmond Crum, and I would like to welcome you to a CDC stakeholder call within a series we are calling Helping Communities Plan for, Respond to, and Recover from the COVID-19 Pandemic. Today's call is focused on K-12 schools and child care settings. Thank you all for joining us today and for all that you're doing every day to help children in your communities. Before we get started, I want to just start with a couple of housekeeping items. This call will be recorded and later posted on CDC's COVID website. This call is not intended for the media. Media can direct questions to media@cdc.gov. Our plan today is to hear a situational update from a leader in our response, followed by details on K-12 schools and child care settings from a subject matter expert here at CDC. We will then have ample time for questions and answers based on questions that were submitted in advance to us. I'm so pleased today to be joined by Dr. Carolyn Wester, Anu Pajavara, and Dr. Jennifer Murphy. Dr. Carolyn Wester is the Director of the Division of Viral Hepatitis within CDC's National Center for HIV, Hepatitis, STD, and TB Prevention. In this role, she oversees the design and implementation of national programs for viral hepatitis prevention, control, surveillance, and outbreak response. Dr. Wester is currently supporting the CDC's COVID-19 response in the role of Co-Deputy Incident Manager, which includes oversight of the Community Intervention and At-Risk Populations Task Force. Anu Pajavara is currently leading community mitigation efforts for schools and childcare as part of CDC's COVID-19 response. Outside of the response, she is the lead behavioral scientist in CDC's Division of Nutrition, Physical Activity, and Obesity, where she provides program evaluation guidance and technical assistance to state and communities nationwide. And finally, we're joined by Dr. Jennifer Murphy. We know that folks are really interested in cleaning and disinfecting in schools and child care settings, and this is a large part of community mitigation efforts. So Dr. Murphy is here to help answer those questions. She's a team lead for the water, sanitation, and hygiene team within CDC's COVID-19 response. And outside of the response, she serves as CDC's environmental, microbiology, and engineering laboratory team lead in the waterborne disease prevention branch. And with that, I'll turn it over to Dr. Wester to share a situational update.
Great, thank you, Malia. I appreciate the opportunity to speak with you all this afternoon. I'm Dr. Carolyn Wester, and within the task force and across CDC, we are working with the White House Coronavirus Task Force, federal, state, and local partners to slow the spread of COVID-19 and to ensure communities remain safe, healthy, and resilient. There are currently 57 jurisdictions, which includes all 50 states, DC, New York City, Commonwealth of the Northern Mariana Islands, Guam, Puerto Rico, U.S. Virgin Islands, and Navajo Nation, reporting COVID cases to CDC. As of today, there are just over 1.5 million confirmed and probable cases, as well as over 91,000 deaths in the United States reported to CDC. Mitigation and containment of COVID-19 is essential to get and keep America open. And CDC is committed to leveraging our expertise and partnering with others on the front lines as they make decisions about when and how to adjust community mitigation efforts. CDC is actively engaged in the whole of government plan to get and keep America open safely and efficiently by providing critical information about COVID-19. Within the Community Intervention and At-Risk Task Force, we are working to provide guidance, considerations, and implementation tools to assist state and local partners and other stakeholders in making decisions about adjusting mitigation strategies to protect the public's health. In the past week, CDC has released new resources to help communities adjust their mitigation strategies. We've published decision tools on K-12 schools and child care programs to help school districts and school and child care administrators and directors make informed decisions about the most appropriate actions to meet the needs of their local communities. Additionally, CDC has published CDC activities and initiatives supporting the COVID-19 response and the President's plan for opening up America again. This 60-page document lays out approaches that state and local authorities, businesses, and other institutions can use to plan of community mitigation measures while protecting vulnerable populations. These guidelines propose the use of six gating indicators to assess when forward from one phase to another. These 6 gating indicators include decreases in newly identified COVID-19 cases, decrease in emergency department and/or outpatient visits for COVID-like illness, decrease in emergency department and/or outpatient visits for influenza-like illness, decrease in the percentage of positive tests for SARS-CoV-2, which is the virus that causes COVID-19, the ability to treat all patients without using crisis care procedures, and last, the establishment of a robust testing program. CDC is providing state and local jurisdictions with technical assistance on testing, surveillance data collection and reporting, contact tracing, infection prevention and control, and outbreak investigation. I'm also pleased to note that as of yesterday, CDC released health documents to help businesses and community organizations operate as safely as possible during the COVID-19 pandemic. Documents yesterday support summer camps, schools, youth sports organizations, institutes of higher education, and restaurants and bars. CDC previously posted health considerations for aquatic settings as well. My colleague Anu will be highlighting portions of the health considerations for schools in her remarks. Considerations documents complement other CDC resources, including interim guidance documents that are posted online and the decision tools that I mentioned earlier that help inform communities setting decisions about resuming and gradually scaling up operations. Together, these critical resources are intended to help communities plan for, respond to, and recover from COVID-19. CDC will continue to update these resources to help state and local leaders as they implement, adapt, and adjust COVID-19 mitigation strategies in their own communities. I want to emphasize that none of these resources supersede state, local, territorial, and tribal public health recommendations. All of these resources emphasize the importance of working with appropriate health officials and adjusting to meet the unique needs and circumstances of the locality. Decisions and strategies about how to operate are implemented at the state, local, territorial, and tribal and local levels because every locale is different and individual jurisdictions have the authority and awareness needed to protect their communities. Much is known about how the new coronavirus that causes COVID-19 spreads. Most often, person-to-person spread is thought to happen among people in close contact, within 6 feet of each other. Person-to-person spread is thought to occur mainly through respiratory droplets produced when an infected person coughs or sneezes, similar to how influenza and other respiratory pathogens spread. These droplets can land in the mouths or noses of people who are nearby, or possibly be inhaled into the lungs. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it, and then touching their own mouth, nose, or possibly their eyes. But this is not thought to be the main way the virus spreads. Typically, with most respiratory viruses, people are thought to be most contagious when they are most symptomatic or sickest. A recent MMWR publication raises concerns about the level of virus spread that might occur before someone experiences symptoms. That is why CDC recommends people stay at least 6 feet away from other people, also known as social distancing, so they do not spread COVID-19 if they have become exposed through close contact with someone who's sick. There is a body of evidence based on about 200 scientific journal articles that supports the effectiveness of social distancing measures, both when used alone and in combination with other measures. The best way to prevent infection is to avoid being exposed to the virus. CDC recommends taking steps to help prevent the spread of COVID-19, including washing your hands often with soap and water for at least 20 seconds, especially before eating or preparing food, or after coughing and sneezing, or after going to the bathroom. If soap and water are not readily available, use sanitizer with at least 60% alcohol. Second, avoid touching your eyes, nose, and mouth. Avoid close contact with people who are sick. Stay home if you are sick. Wear a cloth face covering in public settings where social distance measuring are difficult to maintain. Remember, cloth face coverings should not be placed on children under the age of 2, people who have trouble breathing, or anyone who cannot remove the covering without assistance. People also can prevent infection by covering their cough or sneeze with the tissue and then throwing the tissue in the trash, or use the inside of your elbow. Clean frequently touched objects and surfaces using soap and water, and then disinfect using a product from EPA's List N. As I mentioned earlier, practice social distancing, such as maintaining more than 6 feet of physical distance between people in community settings and staying at home. And with that, I'd like to turn it over to Anu Pajavara, lead for schools and childcare within the CDC's COVID-19 Community Interventions and At-Risk Task Force Community Guidance Team. Thank you.
Thank you, Dr. Wester. We know that there are a lot of questions and concerns related to K-12 schools and childcare at the moment. Many schools are closed for the rest of the semester, and parents, teachers, and others are already beginning to think about what the fall will look like for schools. In addition, childcare setting administrators, staff, and parents have many questions about childcare. As Dr. Wester noted, last week and again yesterday, we were really pleased to announce that CDC posted new tools that, along with other CDC guidance, assist directors or administrators in making mitigation decisions regarding schools and childcare during the COVID-19 pandemic. Adjusting community mitigation strategies does not mean that the threat is over of COVID-19. It is important to follow proven general infectious disease principles, and also important to recognize that each community is unique, and as such, decision-making will vary from locality to locality based on a few things: based on the level of community transmission, based on the characteristics of the community and their population, and based on the community's public health and healthcare systems capacity. Decisions should be made in collaboration with state and local health officials and other partners in order to meet the unique needs and circumstances of the local community and to ensure that decisions align with state and local orders. Strategies should be guided by what is feasible, practical, and acceptable, and should be tailored to the needs of each community. There are a number of actions that schools and child care program administrators may consider to lower the risk of COVID-19 transmission. These actions fall into 4 categories that I'm going to talk about today. The first is promoting behaviors to reduce spread. The second is maintaining healthy environments. The third is maintaining healthy operations. And the fourth is preparing for when someone gets sick. Before I discuss each of these in a little more detail, I just want to note that multiple safeguards can reduce the spread of COVID-19, just like the layers of protections that exist when we're driving our cars. This includes strategies that each individual can take, such as using your seatbelt, as well as environmental strategies such as speed limits, and policies like requiring a test to get a driver's license. Stacking these best practices with several layers of safeguards to reduce the spread of COVID-19 and lower the risk of another spike in cases and deaths is necessary to manage this outbreak while re-engaging our economy. So let me get back to those 4 categories. The first one I'll talk about is strategies to promote behaviors that can reduce the spread of COVID-19. There are several actions that can be taken. Educate staff, students, and their families about when to stay home if they or someone in their household is showing symptoms of COVID-19, and when it is safe for them to return to school or childcare. Make sure that anyone stays home if they are sick or have recently had a close contact with a person with COVID-19. This includes students, children, and staff. CDC has criteria to help directors and administrators decide when employees should return to work. It's also important to teach and reinforce healthy hygiene to students and staff, like frequent hand washing and covering coughs and sneezes. Teaching children to sneeze and cough into their elbows or tissues is important, and realize that this may involve a lot of guidance and supervision for younger children. Assess if the school has adequate supplies to support these healthy hygiene behaviors. Supplies like soap, hand sanitizer with at least 60% alcohol, paper towels, tissues, disinfectant wipes, and no-touch or foot pedal trash cans. Also teach and reinforce the use of cloth face coverings. Face coverings may be challenging for students, especially younger students, to wear in an all-day setting, such as school or childcare. Face coverings should be worn by staff and students, particularly older students, as feasible, and are most essential in settings where physical distancing is difficult. Do not place face coverings on young children under the age of 2, anyone who has trouble breathing, anyone who's unconscious, incapacitated, or otherwise unable to remove the covering without assistance. So let's move on to that second category, which is maintaining healthy environments. It's important cleaning and disinfecting is maintained regularly. Clean and disinfect frequently touched surfaces, including door handles, sink handles, and drinking fountains. Also consider closing communal spaces, such as dining halls and playgrounds that have shared playground equipment if possible. Otherwise, stagger their use and clean and disinfect between use if possible. Minimize the sharing of high-touch materials like electronic devices, toys, books, and athletic equipment. Consider individually labeling containers, cubbies, or designated areas for belonging, and ensure adequate school supplies to reduce sharing of high-touch materials. Ensure ventilation systems operate properly and increase circulation of outdoor air as much as possible, for example, by opening windows and doors. Also consider modifying the layout of a classroom, such as spacing seating 6 feet apart, or cribs for younger children in a childcare setting, placing children head to toe during nap time, and creating social distance on school vehicles. Physical barriers like tape on floors or one-way routes in hallways can also help staff and students distance themselves. And have children bring their own meals if feasible, or serve individually plated meals in classrooms instead of in a communal dining hall or cafeteria. So moving on to the third set of considerations, which are related to maintaining healthy operations. Consider offering options to help protect staff and students who are at higher risk for severe illness. For staff, this might include telework or modified job responsibilities. And for students, this might include virtual learning opportunities. Keep students in small groups with dedicated staff and make efforts to keep them in the same groups throughout the day. And if possible, limit mixing between groups. Could also consider staggering arrival and drop-off times or locations by group. Consider limiting any non-essential visitors, volunteers, and activities involving external groups or organizations if possible. Pursue virtual activities and events in lieu of field trips, student assemblies, special performances, school-wide parent meetings, and spirit nights as much as possible. Pursue options to convene sporting events and participation in sports activities in ways that minimize transmission of COVID-19 to players, families, coaches, and communities. Implement flexible sick leave policies and practices that enable staff to stay home when they are sick, when they've been exposed, or when they're caring for someone who is sick. Consider what your substitute teaching plan will be to cover for an absent staff member. And finally, when feasible, consider conducting daily health checks, such as temperature screenings and checking staff and students for symptoms of COVID-19. I've outlined considerations to prevent the spread of COVID-19, but it's also important for school and childcare programs to make a plan for when someone gets sick. That's the fourth category. Make sure staff, students, and families know that they should not come to school, and they should notify school or childcare officials if they become sick with COVID-19 symptoms, test positive for COVID-19, or have been exposed to someone with symptoms, or who is known for or suspected to have COVID-19. Designate an isolation room or area to immediately separate anyone who exhibits COVID-like symptoms, including fever, cough, and shortness of breath. Immediately separate anyone with these symptoms to help prevent the further spread of infection. Establish procedures to safely transport anyone sick to their home or to a healthcare provider. Sick staff members or students should not return to school or the childcare facility until they have met CDC's criteria to discontinue home isolation, which is available on our website. Finally, school and childcare administrators should notify local health officials, staff, and families immediately while maintaining confidentiality if a student or staff member who is sick is identified. I appreciate the opportunity to share these important considerations for schools and child care programs today, and I thank you for your time and for all that each of you are doing to prevent COVID-19 infection while keeping your staff, students, their families, and your communities safe. I'll stop right here and turn it back to Malia to facilitate our Q&A.
Thank you, Anu, and thank you, Dr. Wester. So you have both shared a lot of information, but I also know there's a lot of interest out there in this topic and the guidance that CDC has. So I know folks on the line have a lot of questions. We've seen them in the box, and we will do our best to answer as many as possible, including those questions that came in to us via email in advance. And please also know, I know there have been questions about whether slides will be shared afterwards. What will be shared is the recording of this webinar, of this call, excuse me, and that will be posted on CDC's website. So know that you can look there for this after our call ends today. So my first question is for Anu, and there's a lot of questions about face coverings. Should children wear face coverings? Could you talk about that a little bit more?
Sure. Yes, this is a common question that we've heard. As we all know, cloth face coverings are meant to protect other people in case the wearer is unknowingly infected. However, face coverings may be challenging for students to wear in all-day settings, especially among younger children. So when feasible, staff and children, particularly older students, should wear face coverings as feasible, especially when physical distancing is difficult. Schools should provide instructions to staff and students on the proper use, removal, and washing of cloth face coverings.
Thank you. So related to this, are there recommendations for employees who can't wear cloth-based face coverings for reasons such as it may exacerbate asthma or claustrophobia or overheating? And similarly, how can we expect little children to wear face coverings? And can a face shield be a substitute? And that question, Anu, if you could help us with that, that would be great.
Sure. Yeah. Again, a lot of really great questions and a lot of interest in this area. And, I just want to thank everyone who is wearing cloth face coverings. Some people refer to these as masks. Everyone has heard this. Me wearing one protects you. You wearing one protects me. So this is just so important that we're all doing this in our communities. In light of data about how COVID-19 spreads, along with evidence of widespread COVID-19 illness in communities across the country, CDC recommends that people wear a cloth face covering to cover their nose and mouth in the community setting. This is to protect people around you if you are infected but do not have symptoms. A cloth face covering is not considered personal protective equipment, or PPE. PPE items like surgical masks and N95 respirators are in short supply and should be reserved for healthcare workers or other medical first responders, as recommended by CDC guidance. So face shields, as you mentioned, Malia, are a type of PPE intended to protect the eyes and face against splashes and large droplets. They are recommended as part of the PPE for healthcare providers caring for those with confirmed or suspected COVID-19. In healthcare settings, a face shield is not a substitute for a respirator or face mask, but should be used in conjunction with these. So regarding the cloth face coverings that the general public should wear, I want to just suggest a few ideas to maybe make them more comfortable. First off, try different forms of face coverings. For example, some masks have elastic bands and others have ties. Try wearing them for short periods of time so you can get used to it. We understand that in some cases, sensory and health concerns can pose challenges. For children or people with sensory issues, you might consider limiting the amount of time a cloth-based covering is necessary for them. And note that several partners have specific resources to help people adjust. For example, Sesame Street has tools targeted to children. And back to the issue you mentioned, Malia, of the employees that may be uncomfortable or unable to wear cloth-based coverings in the school or childcare setting, consider some alternative options. Consider if there's an option for teleworking, We recognize that isn't possible for all jobs, and this might especially be true for school settings. If an employee works in a private office 6 feet away from others, that would limit the need for a cloth face covering to the periods when they are in common spaces. And consider if there might be a different role that individual could play that would limit their interaction with others. Those are some of our current recommendations around cloth face coverings, and we'll be sure to share if we learn something that changes or improves these recommendations.
Great, thank you. Thank you for that information. I know that a lot of people appreciate it and really want to understand what to do as we move into summer and fall and think about schools reopening. Another piece of that work is thinking about how to keep children and staff safe every day. And so we've been getting a number of questions about testing and how that can be part of planning and implementing mitigation strategies. Dr. Wester, could you talk a little bit about if schools and child care facilities should test all children before they return to school or child care?
Yes, certainly. So CDC has released a framework guidance for reopening schools, and you can see that link at the bottom of the slide that's showing on the screen. And it includes guidance based on levels of COVID-19 community transmission, as well as the capacities of the local public health and healthcare systems. On May 20th, CDC also released additional considerations for local jurisdictions for school reopening. And in these guidance documents, CDC recommends that schools take mitigation approaches, such as social distancing, face cloth covers, increased cleaning, home isolation for symptomatic students or for those who have come in contact with cases. CDC does not currently recommend or serologic test results be used for decisions of admitting or excluding persons from settings like schools or workplaces. There's two major types of tests currently: viral tests. Viral tests only determine potential infection at a single point in time and may miss cases in early stages of infection. And furthermore, positive results of these viral tests may be more likely to be false positives in communities with very low rates of community transmission. The second test are antibody tests. So if someone's tested for an antibody test, the presence of SARS-CoV-2 antibodies likely indicates a prior infection, but until the durability and duration of immunity is established, it cannot be assumed that individuals with truly positive antibody test results are protected from future infection. Persons who test positive by serologic tests should continue to follow CDC recommendations to prevent infection with SARS-CoV-2. So testing of students for COVID-19 may be appropriate in the limited context of case investigations and contact tracing. For example, following the identification of a positive case in a student or school staff. CDC contact tracing guidance encourages states with available resources to test high-risk contacts of the confirmed case. But again, CDC does not currently recommend that viral or serologic test results be used for decisions of admitting or excluding persons from settings like schools or workplaces at this time. Thank you.
Thank you, Dr. Wester. And relatedly, do you know if saliva testing, for example, has been validated for children?
Oh, that's a good question. Thank you. CDC is not aware of any scientific publication showing saliva testing being validated for kids specifically. Among EUAs or emergency use authorization approved devices, saliva testing is limited to one EUA approved collection device. That's it.
Thank you. So in addition to thinking about what we do as individuals by wearing face cloths to protect each other when we're out and about or in a school setting, and thinking about strategies to keep kids safe and make sure they're healthy while they're in school settings, we know that folks are really interested in learning about ways to make sure that the environment children are in is also safe for them and clean and disinfected. So we received a number of questions around this, and I would just ask if Dr. Murphy could talk a little bit more about, how often, at what frequency should cleaning and disinfection of high-touch surfaces occur?
Sure, thank you for that question. So surfaces that are frequently touched by multiple people, so these include things like door handles, tables, light switches, faucets, these should be cleaned and disinfected at least daily. However, we recognize that more frequent cleaning and disinfection might be required based on the level of the use of these surfaces. So each facility really is unique. So directors and school administrators really should work together to assess these high-touch surfaces in their own facilities and develop a schedule for cleaning and disinfecting that's really tailored to that setting.
Thank you. And so since we're talking about schools and childcare settings, and especially with very young children, we know sometimes they may be playing with toys or bring a toy to school. Could you talk a little bit about disinfecting of toys specifically? We received questions about that and how often that should take place.
Sure, that's a great question. So there are a few things to consider when you're thinking about cleaning and disinfecting toys. First, I just want to go over a little bit of terminology to be familiar with. So cleaning means using soap and water to remove dirt and debris. This can also decrease how much of the virus is on the surface or object. So this should always be done first before using a sanitizer or a disinfectant. So sanitizer is a product that also reduces the amount of germs on surfaces to levels that are considered safe by a number of public health codes or regulations. Sanitizers are used for toys that children might put in their mouths or also on food contact surfaces. And a disinfectant is a product that destroys or inactivates germs on objects or surfaces. So CDC recommends the use of disinfectants on the Environmental Protection Agency's list in. And this list includes about 400 disinfectants that are effective against the virus that causes COVID-19. It's just important also to remember disinfectants should not be used on objects that children might place in their mouths, as a lot of times these can be toxic if they're swallowed. So in terms of frequency of cleaning and sanitizing or disinfecting toys, the first step really is to identify which toys cannot be cleaned and sanitized or disinfected, and really just maybe take those out of use. So we recommend that toys should be frequently cleaned and then sanitized or disinfected. Ideally, this would be between use by different children. So again, you first want to clean with water and soap or detergent, rinse, then sanitize or disinfect with one of these EPA registered products. Rinse again, and then air dry. And in some cases, some toys might be able to be cleaned in a mechanical dishwasher, so that's also an option. And then cloth toys that can be machine washed should be used really just by one individual at a time, or not used at all. And then these toys can be laundered before being used by another child. And so just a couple of really quick safety things to also remember. Cleaning, sanitizing, and disinfecting products should not be used in close proximity to children, and it's important to have adequate ventilation during the process of cleaning or sanitizing or disinfecting, just to prevent children and caregivers or teachers from inhaling potentially toxic fumes. The cleaning materials should be kept secure and out of the reach of children. And again, it's important to just follow the manufacturer's instructions on all of these different products. So for example, which concentration you might use, or the application method, or the contact time for the product, and make sure that you're using the proper PPE for application of these products. So you can find a lot more information on cleaning and disinfection of toys and other surfaces in the child program setting and CDC's guidance for child care programs that remain open.
Thank you. Thank you, Dr. Murphy. So I see we also have some questions about health checks. And it would be great if we could talk a little bit about what types of screenings schools and child care programs should do all day. Anu, could you talk a little bit more about that? Health checks, screenings, what schools and child care centers need to think about?
Yeah, absolutely. I'm sure schools, as they prepare for the fall, are trying to think about how they can implement these practices, and childcare that are open currently are probably already trying to implement some of this. So you're exactly right. You know, if possible, we recommend conducting daily health checks, whether that's through temperature screening or checking students or staff for symptoms of COVID-19. And, you know, there's several things that you can do to protect your staff while they conduct temperature screenings or symptom checking. So it could be maintaining a distance of at least 6 feet from others, or it might be using physical barriers to eliminate or minimize exposure due to close contact. So let me just talk through a few examples of how to do this in a little more detail, and that might help. And these examples are available on that same guidance page that Dr. Murphy just mentioned for child care programs that remain open. So the first example is one that really relies on social distancing. In this approach, schools and child care facilities can ask parents or guardians to take their child's temperature either before coming to the facility or upon arrival. Upon their arrival, they can stand at least 6 feet away from the parent or guardian and the child. Ask the parent to confirm that the child does not have fever, shortness of breath, or cough, or other symptoms. You can also visually inspect the child for signs of illness, which would include flushed cheeks, rapid breathing or difficulty breathing, fatigue, or extreme fussiness. In this example, you wouldn't need to wear personal protective equipment if you can maintain a distance of at least 6 feet. So that's the first example. Let me talk about a second example that relies on some sort of barrier or a partition. In this example, you stand behind a physical barrier, such as a glass or a plastic window or some kind of partition to protect yourself if the child being screened sneezes, coughs, or talks. Make a visual inspection of the child for signs of illness that I just mentioned, such as flushed cheeks, rapid breathing, fatigue, extreme fussiness, and conduct a temperature screening by reaching around the partition or through the window. In this example, you want to make sure your face stays behind the barrier at all times during the screening. And the third example is social distancing or barrier controls can't be implemented during screening. You can use PPE, personal protective equipment, when you're within 6 feet of a child to conduct the screening. However, reliance on PPE alone is a less effective control and more difficult to implement given PPE shortages and training requirements.
Thank you. Thank you, Anu. That was really helpful. You know, I think related to this is the question about what schools or child care centers should do if someone is sick, gets sick during the day. Could you talk a little bit about that, please?
Yeah, absolutely. You know, schools and child care programs may want to consider several strategies to prepare for when someone gets sick. Some of the key points to keep in mind is first, advising staff and families of sick students of home isolation criteria, which means sick staff members or students should not return until they have met CDC's criteria to discontinue home isolation that I mentioned before. Be prepared to immediately separate staff and children with COVID-19 symptoms at school. Individuals who are sick should go home or to a healthcare facility, depending on how severe their symptoms are, and follow CDC guidance for caring for oneself and others who are sick. It's important to identify an isolation room or an area to separate anyone who has COVID-19 symptoms or test positive but does not have symptoms. Also, in accordance with state and local laws and regulations, school administrators should notify local health officials, staff, and families immediately of any case of COVID-19 while maintaining confidentiality in accordance with the Americans with Disabilities Act. And inform those who've had close contact with a person diagnosed with COVID-19 to stay home and self-monitor for symptoms and follow CDC guidance if they develop symptoms. Close off areas used by a sick person and do not use these areas until after cleaning and disinfecting them. Wait at least 24 hours before cleaning and disinfecting. If 24 hours is not feasible, wait as long as possible. Ensure safe and correct use and storage of cleaning and disinfection products, including storing products securely away from children.
Thank you. So thinking also to our our school communities and how varied they can be, both in the children that are in them and also in the staff that interact with students every day. What are the strategies or actions that should be taken to ensure the health of vulnerable populations of students and staff? Anu, could you help us with that question, please?
Yes, this is a very important concern, and I'm glad you raised it, Malia. You know, it really is vital to protect the health of students and staff with special needs or at higher risk of severe illness from COVID-19. If you have staff members or teachers that are age 65 or older, or those of any age who have serious underlying health conditions, encourage them to talk to their healthcare provider to assess their risk and to determine if they should stay home. If you have children with underlying health conditions or with disabilities, talk to their parents about their risk and how their children can continue to receive the support they need. Consider offering options for students and staff with higher risk for severe illness that limit their exposure risk. This might include modifying job responsibilities for staff or providing virtual learning opportunities for students. And make sure to put in place policies that protect the privacy of people at higher risk for severe illness regarding their underlying medical conditions.
Thank you. So we're also getting a lot of questions in the question and answer box and ahead of time, kind of going back to this issue of cleaning and disinfecting, but also preparing for schools to start and then being able to do those, those cleaning needs, meeting those cleaning needs. So maybe we could talk a little bit about what supplies schools and child care programs should consider ordering in preparation for reopening, whether that be the summer or the fall.
Sure, I can address that, Malia. Supplies that they might consider could include soap, hand sanitizer with at least 60% alcohol for staff and older students who can safely use hand sanitizer, paper towels, tissues, disinfectant wipes, cloth-based coverings as feasible, as we discussed earlier, and no-touch foot pedal trash cans. While it's important to have appropriate supplies on hand, do not overuse or stockpile disinfectants or other supplies. This can result in shortages of appropriate products for others to use in critical situations.
Great, thank you. And related to this, there are questions in the question and answer box related to not just cleaning and disinfecting inside classrooms and child care centers, but also thinking about the fact that many schools have playgrounds and other outdoor equipment. So Dr. Murphy, could you talk a little bit about, should students be allowed to play on playgrounds? How should they be cleaned? What do people need to know to think about that piece of the school?
Sure. So outdoor areas like playgrounds and schools and parks generally require just normal routine cleaning and don't require disinfection. High-touch surfaces made of plastic or metal, such as grab bars or railings, should be routinely cleaned with soap and water. You can do some targeted use of disinfectants as long as it's done effectively, efficiently, and safely on outdoor hard surfaces and other objects that are frequently touched by multiple people. This really is location and situation dependent and should be determined when schools and facilities are assessing their specific facility and developing a schedule for cleaning and disinfecting that again is just really tailored to that setting. We do have a lot of questions about outdoor spaces like sidewalks and ground covers. And we really just say cleaning and disinfection of these types of surfaces is not recommended, as it's not an efficient use of disinfectant supplies, and it really hasn't been proven to reduce the risk of COVID-19 to the public.
Thank you, Dr. Murphy. So we're also getting a lot of questions about small group sizes and dedicated staff. And in our guidance, we talk about cohorting, and specifically people in the question and answer box are asking about the number of 10 as a group size. Anu, could you talk about that a little bit more? How many students and staff should be in a small small group or cohort? What does our guidance say around that?
Yeah, we've gotten that question a lot in our office as well, and people are hoping to get a precise number from us, but CDC doesn't recommend a specific number of students in a class or specific ratios for students to staff, but rather the number and size really should be based on your specific context and situation. We do suggest you try to ensure that student staff groupings are as static as possible by having the same group of children stay with the same staff and limit mixing between groups. Additional strategies such as staggering drop-off and arrival times, staggering playground times, and other group activities such as art, music, and physical activity could also be used.
Great, thank you. So thinking about, again, we received a number of questions talking about children and staff that may be in a vulnerable population group. Are children with conditions such as asthma considered high risk for severe illness? Would it be best to keep these children at home, away from school, away from child care centers? Dr. Wester, could you help us with that?
I will, thank you. I guess, first of all, it's most important to note that this is a highly personal decision and not an easy one. It's important to consult with your healthcare provider for advice on your specific circumstances. What we do know is that people of all ages with underlying medical conditions, particularly if not well controlled, may be at higher risk for severe illness. It's worth emphasizing, however, that we're still learning a lot about how COVID affects children. Based on currently available evidence, children don't appear to be at higher risk for COVID-19 than adults. And while some children and infants have become sick with COVID-19, adults make up most of the known cases to date. Children with confirmed COVID-19 generally show mild symptoms. However, it's not yet known whether some children might be at higher risk for severe illness. For example, we've begun to see a multisystem inflammatory syndrome in children that resembles a disease called Kawasaki's. While this still seems rare, it is serious and points out that we have much more to learn about this virus. In the meantime, there are steps that any parent can take to help their children stay healthy and also stop the spread of COVID-19, which includes taking steps to protect children and others from getting sick, as we've mentioned before, cleaning hands often, avoiding people who are sick, cleaning and disinfecting high-touch surfaces daily, limiting time with other children, practicing social distancing, altering travel plans, limiting time with older adults and people with serious underlying medical conditions, and remembering that children 2 years and older should wear a cloth face covering as feasible. Apart from the health risks posed by COVID-19, there may be other factors to consider, including parental job requirements, the inability or ability to work from home with your child or children, the mental health of your family, your child's need to socialize with peers, the need for our children to learn in ways that many of us parents feel inadequate to provide, and probably some additional factors that are unique to each child and family. So lots of different considerations and very important to individualize.
Thank you. So there has also been a lot of news coverage recently about a new condition that's showing up in children, and I'm wondering if you could tell us a little bit more about pediatric multisystemic inflammatory syndrome.
Sure. CDC is concerned about the emergence of what you just described. It's called Multisystem Inflammatory Syndrome in Children, or MIS-C, and the potential association with COVID-19. So at this time, as more data is emerging, CDC is working with domestic and international partners to better understand and characterize this new syndrome, as well as its prevalence and its risk factors. On the 14th of this month, CDC issued a nationwide health alert to clinicians with background information on this syndrome, including a new case definition, We're asking all healthcare providers to consult with state, local, and territorial health departments on any patients who meet the criteria. It's a rapidly changing situation, and we will continue to share the latest info with the public as new evidence emerges.
Thank you. So we shared a lot of information about what different schools can do and what individuals can do, but maybe we can talk a little bit more broadly about what are different models that schools might consider to lower risk. And Anu, could you talk about that a little bit more, please?
Yeah, absolutely. And, you know, I have 2 elementary school children myself, and I know many parents and teachers are probably wondering what school might look like this fall. And many school systems have been considering a variety of models or ways to structure their learning. And you can kind of think of these models as being on a spectrum from lower risk to highest risk. Really, the more people a student or staff member interacts with, and the longer that interaction, the higher the risk of COVID-19 spread. So when you think about it, the lowest risk in a school setting would be the one that we've been doing recently in many places, which is students and teachers engaging in virtual only classes, activities, excuse me, and events. A school model that presents more risk than that, than a virtual only environment, would be reconvening in person, but as small in-person classes, activities, and events. In this model, ideally groups of students would stay together and with the same teacher throughout and across school days, and groups would not mix with each other. Students would remain at least 6 feet apart and wouldn't share objects. And this could be like a hybrid virtual and in-person class structure, or possibly staggered or rotating schedule to accommodate these smaller class sizes. So that's kind of in that next risk category. And lastly, the highest risk category would be full-size in-person classes, activities, and events. Students would not be spaced apart, they would share classroom materials or supplies, and mix between classes and activities as we have typically done in regular schooling.
Thank you. So we've also seen a number of questions in the question and answer box regarding buses. So obviously that's a big part of the school day as well, going to and from school, and children are on buses. Anu, could you talk a little bit about what are recommended safety practices on buses or other vehicles that child care facilities, for example, might be using to transport students during the day?
Yeah, and we want to think about this in the context of both the drivers as well as the students. So for bus drivers, potential sources of exposure include having close contact with a passenger with COVID-19, by contacting surfaces touched or handled by a person with COVID-19, or by touching their mouth, nose, or eyes. All frequently touched surfaces on buses and vehicles transporting students and children should be cleaned between use as much as possible, and at least daily. When possible, windows should be open to allow for airflow and to improve ventilation. Consider spacing riders out as much as possible to increase social distancing. And all drivers should also practice the same safety protocols we've been talking about as indicated for other staff, such as hand hygiene and cloth face coverings.
Great, thank you. So we've also gotten some questions during our call about the 24-hour waiting period for cleaning. So Dr. Murphy, could you talk about that, about the recommendations related to the 24-hour waiting period before cleaning when someone has been in an area and has later been learned to be sick?
Sure, yeah. So CDC has guidance for cleaning and disinfecting community facilities such as schools or daycare centers after persons suspected or confirmed to have COVID-19 have been in that facility. It's really unknown how long the air inside a room occupied by someone with a confirmed COVID-19 remains potentially infectious. So for indoor areas, facilities will need to consider factors such as the size of the room and the ventilation system design. So this includes the flow rate or the air changes per hour, and location of supply and exhaust vents when they're deciding how long to close off rooms or areas that the ill persons had been in before they start disinfecting. So taking measures to improve the ventilation in an area or room where someone was ill or suspected to be ill will help shorten the time it takes for the respiratory droplets to be removed from the air.
Thank you. I think we're also seeing a number of questions about food service in schools and child care centers. And Anu, could you talk a little bit about what modifications schools or child care programs might make for meal times for food service when they reopen?
Sure. You know, if possible, having children bring their own meals is one strategy, or serving individually plated meals in their classrooms instead of in a communal dining hall or a cafeteria. And, you know, using disposable utensils and dishes, if possible, is a strategy. And if the disposable items are not feasible or desirable, ensure that all non-disposable food service items are handled with gloves and washed with dish soap and hot water or in a dishwasher. Individuals should wash their hands after removing their gloves or after directly handling used food service items. If food is offered in any event, have pre-packaged boxes or bags for each attendee instead of a buffet or family-style meal. And no matter what food service model you pursue, it's important to ensure the safety of children with food allergies.
Thank you. So again, we've talked about a lot of things that school administrators, teachers, child care center administrators can do to help protect students and lower risk. We know this is a really stressful time for all of us. It's a new world, but I think folks are also interested in understanding how can schools, how can child care programs support coping, support resiliency, both in their staff, students and their students' families. You know, we're all part of a larger community. And I'm wondering, Anu, if you could talk a little bit about that.
Yeah, you're exactly right, Malia. It is a challenging time for everyone, and schools and child care programs have such an opportunity to provide that kind of support. So these types of schools and child care programs can make sure to support the community by encouraging staff and students to be eating healthy, exercising, getting adequate sleep, and finding time to unwind. Encourage employees and students to talk with people they trust about their concerns and how they're feeling. And consider encouraging employees and students to take breaks from watching, reading, or listening to news stories about COVID-19, including social media if they're feeling overwhelmed or distressed.
Thank you. I think we're all grappling with that and looking for resources to help us during this time. So we also received a number of questions and comments in the Q&A box related to whether these guidances are mandates. I just want to let folks know that CDC is not a regulatory agency. These are guidance documents, they're considerations. As we stated before, decisions need to be made within the local context, and we encourage everybody to work with state and local public health agencies as they make decisions about reopening and operating. We also received a number of questions as to whether the slides would be available and where they could access these documents. So as I said, we will post a recording on CDC's website. All of these guidance documents that were on the slides, the 2 slides today, are on CDC's website. We will also email out to the registrants of this webinar a list of resources along with web links to make it easier for you to access these documents that we've shared today. So with that, this concludes the Q&A portion of our stakeholder call. We are almost at 5 o'clock. I want to let folks know that we will be hosting 2 additional stakeholder calls this week, one tomorrow and one on Friday. And these will cover workplaces and mass transit. And then on Friday, we will be covering youth sports. Thank you very much for joining us today. We know that there are many questions around this issue, and we hope that we answered as many as we could. And we hope that you look at CDC's website for more guidance as to how to reopen and operate schools and childcare settings in coming months. Thank you very much for your time.